right now. So, what I want to talk about here a little bit is this. So, I talked about this in my last walk, and I'm like, okay, let's go. Where does physical therapy really get some of their information, not all their information? You know, when you see a therapist, like obviously they have their training that they did in school, and maybe they went in the residency was specific to, let's say for example, outpatient orthopedics, and they might have gone into maybe a 6 month residency on that, on top of their clinical rotation. So just give me 1 second here. I'm just going to see if I can pull this up so I can see what everybody else is seeing, which would be my live stream. See if I can populate that. I might not be skilled enough. It's been a while since I've done these. Do this. So this will help me with any questions that you have. Hey, how you doing? So we're going to talk a little bit about one of the big things. This is one of the magazines that comes out. So I'm going to go ahead and turn that down. There we go. So this is the American Physical Therapy Association, and in this actual month, they talk about the role of physical therapy in burn management. So I'm going to kind of bounce off this a little bit and into the idea of what any discipline, in this specific case, physical therapy, what people think of it is physical therapy. So the first thing people think of is just massage, maybe exercise, maybe some sort of trainer of some sort. Sorry about that. I lost my connection there for a second. I apologize. There we go. Don't know why I lost it. I shouldn't have lost it. Got enough Wi-Fi band here. But anyways, so what I was getting back to is this specifically, you know, this article talks about the role of physical therapy in burn management, but what's the role of physical therapy in anything? And so I'm talking about truly what's the role and what's your guys' thoughts of when it comes to physical therapy. And really, is physical therapy just massage, some basic exercises, and I don't have a clue other than that? Or, you know, what's the background? What's the educational component to physical therapy? Because you go and you listen on the internet, and really you can't tell the difference between an exercise physiologist or an exercise trainer guy or girl, or some sort of bodybuilder that's in the gym and doing stuff that sounds like it's kind of quasi physical therapy stuff. Or, you know, you see these, you know, they're talking about, you know, example, the rotator cuff, and you know, like you have somebody who's really fit, you know, literally head to toe, look like they should be in some sort of model fitness magazine, and you kind of wonder, what the heck is their credentials? You know, did they just look all this stuff up on the internet and then just kind of spew it back out? So let's talk about that a little bit in regards to burn management. You know, that'll kind of give us some credence on some research-based as well as some other avenues that physical therapy really goes down that you might not think of. I think in one of my walks I talked about, or actually All right. So let's see if you can hear me now. Yeah, I knew I should be getting a different microphone. I gotta spend a little of that money and get a different microphone than this. This is not good enough. But anyways, so all right, so thank goodness for family. Okay, so what I was talking about here is that specific LTAC piece, that long-term care. And so either they're going to go to a senior nursing facility, or they're going to long-term care, or they're going to go home, or they might go to some family's home. So that's really when a physical therapist is working in the hospital, and what's their most important piece in the hospital. One of them is where they're going upon discharge from the hospital. What kind of safety do they need while they're in the hospital? We kind of give the discretion or the explanation on how much assistance the patient needs, whether it's a CNA, nursing staff, what type of adaptive equipment they need while they're in the hospital, so that they can reduce the risk of falls while they're in the hospital, and obviously reduce hospital liability. So those are the big pieces that's kind of just one subset category of what a physical therapist does in an inpatient environment. Another whole subset would be just burns and wound care in the hospital. So you could see a physical therapist, and specifically that's all they do is wound care. So the reality is most people don't realize that nursing does have a subset that's all about wound care. There's a wound care nursing profession, but there's also a subset of physical therapy that is just wound care. Actually, to get licensed as a physical therapist, you have to know a great deal about wound care, whether it's sharp debridement, whether it's some sort of medication to either eat up or agitate certain kinds of wounds, certain kinds of bandages to absorb wound vacs, all kinds of stuff like that. There's a whole subset of physical therapy in the hospital environment that just does that. We could be doing wraps to decrease swelling in the legs, to improve wound care. So what they call Una boots. So needless to say, that's another whole subset category in the hospital environment. And that goes on to really physical therapy in some sort of burns or wounds. So in this case, I'm going to show you this page. This kind of shows a person in one of those boots. It almost looks like a cast, but it's not. It really is. It's kind of like this wrap, and it kind of it's kind of pasty, and they wrap it up and they bandage around it, and it kind of really pushes and holds that fluid out, because you don't want a lot of swelling in there at all when you're trying to heal something like a burn. They might put bandages across the top afterwards. There's a whole new subset of wound care and burns where they actually put your live tissue on that, which I don't know a lot about, but that subset of physical therapy just does the wound care and burns. And then there's another whole subset of physical therapy while you're after the burn that's just physical therapy, because obviously there's scar tissue from the burns, which there's pain. There's all kinds of what we call scar mobility, where the scar kind of gets held down, so we have to do what's called scar mobilization. And then there's that whole piece of making sure that the joint itself is able to go through most of its motion again. Maybe they got a burn on their knee. Give me a second. Let's just say, for example, they got a burn across the top of their knee, and their knee won't bend like it's supposed to, because the scar tissue is holding it, and the scar from the skin won't allow it to bend, allow it to stretch. So we'll do therapy on that to improve the knee joint motion to get them back to whatever it may be, whether it's, there's so much limitation in the knee joint. For example, if you don't have at least 90 degrees of knee bend, you're not going to be able to go up a pair of stairs, go up and down a ramp or an incline correctly, because of that lack of motion is going to make your ankle have certain issues with the ground, as well as you're going to see your hip start doing a lot more to compensate for that lack of knee motion. So scar tissue itself is huge when it comes to that piece of it, that you definitely want to keep flexible in that whatever joint you're talking about. In this case, it was this person's lower leg. So when we'd come out and see them afterwards, we'd be worrying about the ankle. So we'd be worried, making sure they could get enough of their ankle motion back so that they could clear their foot off of the ground so they wouldn't trip and fall over themselves. So there's that piece of it. Now, this poor soul here, he's in the hospital, and he's on he's in a lift, what we call a Hoyer lift. And as you can see, his legs are all bandaged up. And what they're looking at there is trying to get them out of that bed to reduce the risk of blood clots, improving their digestive system, reducing the risk of upper respiratory infections like pneumonia or anything along those lines, any type of bacterial infection in the lungs from just being flat or static for too long, as well as bone density, as well as muscle mass, connective tissue, ligaments and tendons. They all start to get weak and frail when you're not putting body weight through them and letting gravity push down, and you work against gravity all the time. You don't realize all these things that we take for granted. And in this scenario, this person right here, is going to suffer a lot because they literally have not been up moving themselves. They're so weak that they can't even afford to stand. Now, they might not be allowed to stand because maybe they have their tendon in the back, which I'll show in a second. There's a tendon that we have in the back of our heel area. It's called the Achilles tendon, and it has two muscles attached to it. So it has your calf muscle, but also known as your gastrocnemius, and it also has another larger muscle called the soleus muscle that's most of the size of your back part of your leg. And they both come down to make up one tendon called your Achilles tendon on the back side of your heel that everybody can touch. And if you have a trauma to that, or if you haven't been weight bearing for a long time, that tissue will not be flexible like it's supposed to when I'm bending this foot upwards, because when I bend this foot, that tendon in the back stretches. And what happens is if it's been long enough and you put weight through it quickly, you can tear or snap it. And next thing you know, you have a huge problem. Now the foot can't go downwards correctly, because that's exactly what those two muscles do. They allow your foot to point down towards the floor like a ballerina. And so that might be another reason why in this picture, this gentleman is in a Hoyer lift and not allowed to stand, is because these Achilles tendons haven't had weight through them in a long time. And the issue there is we don't want them to tear those particular tendons. Now, this picture is by, this actually is a physical therapist in this picture. His name is Walter, and he's got a master's degree in PT, transferring a patient to a wheelchair to prepare for early mobilization and working on standing and ambulation. So that's exactly, without me reading it, that's, what they say, a picture's worth 1,000 words. So that's exactly what we're looking at here, as this person has been mobile for quite a long time. And in physical therapy, it's not exercise in this case. In this case, we're worried about mobility. We're worried about all those other pieces. We're worried about bed sores, contractures, which I was talking about here with this Achilles tendon. That's what's called when the tissue doesn't want to lengthen and shorten like it's supposed to, and it can tear easily. We're worried about bone density and all those digestive issues. Anything that would keep someone in bed for a long time, we're talking days and days and days, that's a very bad thing. Reducing risk of blood clots, that's huge, 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 especially in this person because it's in their calf. And if you're gonna have a blood clot, the classic case, it's that blood just sitting in that calf for a long time, starts to coagulate or starts to solidify, and then, obviously you can blow a clot, which is called an embolism. And then you're going to have more problems than what this person's going through. And then I'm going to show you in the next picture, the next page. This person is up here walking, and he's got himself a wheelchair, and he's got two people next to him. This picture is taken where he's got two people ambulating this person. This typically is not the case. Usually just have one person doing this. They're doing this for the video. I do like the fact that they have a wheelchair in the back of them, and they're just getting used to just bearing weight through the legs. But this guy in the front here, ain't doing squat. This person was to fall. This guy isn't doing anything at all. If anything, this guy should be on the other side of the wheelchair. One person on one side, one person on the other. Now this girl, she's got her arm underneath the patient. Now she may be able to help a little bit or throw this person back into the wheelchair, which would be quite traumatizing. You might injure the patient or yourself. Smart thing is to have this person literally have this wheelchair in the middle of the hallway with one person on either side of them, okay? And then you'd be fine. That way you both can control the wheelchair, you both can control the patient. If you're both are going to be out there, you might as well take advantage of that extra pair of hands. This is a great picture, and it shows you if this is actually what's happening in the work environment, what we call a work environment or the hospital environment. This is a big no-no. You would not do it like this at all. I'm really hoping this is for photography only. And it shows, this next picture shows this great kid. Looks like he's got a burn on his hand or his arm. Classic case of a, family not paying attention to their loved one, and they get up to a stove and they pull the hot grease or water down to them because they had the handle facing outwards instead of facing inwards, and they grab it. There's, Curious George, and they pull on it and they burn themselves, their arm. Probably, in this case, is not showing the kid's face, but probably unfortunately burnt the child's face. But in this picture, it's really showing what physical therapy's gone to over the last, let's say, 15 years or so when it comes to some things. And what I'm referring to is this technology which we have video games for and everything else nowadays. Now, back when they had the Wii, Nintendo did back probably almost 20 years ago now, they had that balance thing for the Wii balance, and you could do certain activities with the hand. I'm doing this because they had those little controllers we did. I'm not being sponsored by Nintendo. If I was, this would not look like this at all. But anyways, and so what they've done nowadays, going into, VR and something like that, and the Oculus, physical therapy is using more of that, could use it for, I'm going to branch off here for a second from what I'm talking about with the burns in the hospital. You could use it for vestibular balance issues, dizziness, any way to, make the activity a little more palatable to do for the patient or the loved one so that they will be engaged to do it to improve their balance or strength or coordination. In this case, they're working on this kid's arm to stretch out his arm. You can't see, but I know what they're doing. They're stretching out this kid's arm because obviously he probably has a scar all the way down his arm, and we want to get that arm to stretch all the way out through the chest, the elbow, wrist, and hand. Otherwise, it's going to pull in. He's going to have all this scarring in this area, and it won't allow his arm to stretch out. So they're working on that, and I'm sure it don't feel good for the little kid, but that's what they're really doing in that picture. And they've been doing this type of work for whether it's batting a balloon or whether in this case it's a kid playing a game. But anyways, it's a cool little tool that you do. Probably for my generation that grew up on video games. And then obviously everybody after us that probably has, if they were lucky enough like I was, in the senior nursing facilities, 20, 30 years from now, we'll all have video games in them because that's what we grew up on. We didn't grow up on Gunsmoke and The Young and Restless, that if we did, it was on reruns, so I think in the future what you'll see in senior nursing facilities are going to be all video games. Who knows? Maybe it'll be all VR. We won't think we're there in the nursing home. We'll think we're on a beach somewhere. Here is a really significant picture of a gentleman that's burned basically this entire face and head. In this picture, let's see if I have a caption here. This shows caring for patients with burns, taken interdisciplinary team photo covered by Phoenix Society. So this is basically a photo, and it's got 3 different disciplines. My guess is it's probably physical therapy, occupational therapy, and it's probably a recreational therapist. So this was, you don't see a lot of Well, you do see recreational therapists in the hospital, but it's more of a transitional care unit where they're not in the inpatient piece. They've been graduated from the inpatient, and now they've been transferred onto another floor in the hospital. If it's in a very richly expensive place, they'll have what's called a TCU, or transitional care unit, which were called back in the day, and where you get 3 hours of therapy with it could be speech therapy in there too, but this is just a photo op. And right here, they're just looking at this poor gentleman's hands that are really scarred, and they're kind of held in like that. And it's, who knows how much mobility this gentleman will get back, but they're not really doing therapy in this picture. This isn't therapy at all for this particular patient. Let me just scroll down here. Let's see. If you guys have any questions on that stuff, I'm always here to kind of give you guys some insight into that. All right. So this last caption here is Burns Resources. So the American Burn Association, or AmeriBurn.org, offers continuing education and certification for PTs working in burn management, and holds an annual multidisciplinary conference with programming in all aspects of burn care. So this particular article in this month, in July's, specifically has several of these therapists probably in here that have all went to some extra courses. So most, if not all, anybody who's got a license or a certification in whatever state, they usually have to have some sort of continuing education courses, or CEUs, continuing education units. And my discipline, physical therapy, has to have 30 every year, at least in the state of North Carolina where I'm at. It's every 2 years. Some states it's every 3 years. Some states, so mine, I have to renew every 2 years. And so if you specialize in any of these particular, in this case, burns, you would get maybe an extra, you go for extra education. You might have some sort of credentialing. You might take an exam, and you might get some sort of initials after that you've passed a certain test, so that you have, now that you're now a, extension of your American Physical Therapy or physical therapy license. This gentleman has a master's degree. I have a doctorate degree. We both are licensed physical therapists, but he's taken some extra courses in this case for maybe a certain type of burn, and the type of treatment that you do for that. So this next one is really, this is just in PT Voice Matters in the Media. So, well, I've been a physical therapist in the profession 25 years. So this has always been an issue. Physical therapy as a profession is one of the youngest. I mean, occupational therapy is even younger than that. So if you looked at medical doctors being the oldest profession in the medicine world, nursing being second, and then from there you have chiropractic, then you have physical therapy, occupational therapy. Somewhere in the mix there is recreational therapy. And then in there is speech. Speech is somewhere after there too. Speech therapy is also branched out. They've tried to make theirs as, I'm not a speech therapist, but I know a bunch of them. How does it go? SLP, speech language pathologist. So they really don't, they call themselves a therapist, but they really call themselves a pathologist. They've really tried and go towards the diagnostic, swallowing stuff. They do all kinds. If you want more about speech therapy, you could always, that'd be one thing I'd like to do maybe at some point in my channel is reach out to a couple of different speech, a couple of different therapists, and really just get some sort of podcast going in regards to that. So that's a great idea that I might talk about down the road. You never can tell. But in this case, they're really talking about, in this article, talking about, what we do, how we advocate ourselves on a daily basis. So whether that's, talking to physicians who, I'd love you guys to talk to a physician and, hey, do you know the difference between a physical therapist and an occupational therapist? They're not going to be able to tell you. I mean, I've been doing this for almost 30 years, and you still have, you still have that medical doctor still doesn't have a clue. They might say, yeah, physical therapy, like they walk people and they get them out of bed. And an occupational therapist, yeah, they get their clothes or bathe them, or I'm not really sure what an occupational therapist does. So at least in physical therapy, we've been around a little bit longer, or maybe we've been a little bit louder, or advocate for ourselves a little bit more, and so maybe that's why they know more about us than occupational therapists, but it isn't much more. But anyways, this article really talks about how do we really get ourselves out there more than we have. And so they're talking about here, one little caption is, as a clinician, it's frustrating when you see stuff that's out there, referring to on the internet. It's not from somebody who is a musculoskeletal expert, which we are. I would also say that we're, what's the best phrase? We're ambulation professionals. We get a lot of education and really break it down to the math in regards to ambulation transfers, stair negotiation, anything functional movement. We're professionals in functional movement, if you wanted to say that. And part of it is musculoskeletal, but I would have said this, lady, I would have said that that would be us. We are professionals in functional movement, way beyond medical doctors. We get way more education than any other profession when it comes to functional movement. I guess a kinesiology expert, they would probably be right up with us. We took a lot of kinesiology classes. I guess you could be a kinesiologist and then go to school for PT. We get more of the pathophysiology, the more of the medical based than kinesiologists do. So if you wanted to look like what's professions close to us, it would probably be that. And so in finishing this caption, it's not from somebody who's a musculoskeletal expert, and so to be able to represent our field with good information is just an incredible honor. So this is by this lady, Carrie Pagliano. I'm probably close. One thing I'm not good at enunciating names. I'm barely good at memorizing them. So this talks about staying the message. What's physical therapy? We need a bigger voice, and the way we get that bigger voice is by having local physical therapists contact their media. So I think it's more than contacting their local media. I think local media has really taken a back seat. Hence, here I am on the internet. They don't have the keys to the locks to the doors anymore. Who can, who cannot say what they want on their broadcasting station. So I think the best thing that we can do is what I'm doing right here, and I think we do that in spades. I take a lot of pride in what PTs do for society and why we would not want to shout it out. And why let me say it again. And why would we not want to shout it from the rooftops? Okay, that's from a Teresa Marco. That's a kind of a cliche, and its wording is kind of fumbly a little bit, as you can see. But in this article, they really specifically just talk about that, and that's been going on. I mean, this is an article that you could read, like I said, 25 years ago, back in the early 90s, when there wasn't even the internet, but you had local newspapers and stuff like that, and like, hey, how are you getting your voice out in the profession? And back then, it was really just journals and magazines, peer-reviewed journals and stuff like that. And now it's gone into the internet and the podcasting and stuff like that. So, we're always talking about the American Physical Therapy Association. That's basically the organization that manages or is our society. It's just, if you want to look at, advocates for us as a profession with all the other professions, with the legalities of Congress and the Senate and the whole federal government piece. That is who is there for us, when laws going to directly affect us as a profession, whether it's they want to reduce payment structure or they want to change payment structure depending on what environment you're working in, or whether it's we're not going to allow you to do this or that and the other thing. Like I talked about in the last podcast when I was out, and that was a misstatement. When I was out on my walks in my last live, I guess you would call it that. I guess you could call it a podcast of one. It's no one else there, having a conversation with you. Where essentially, that's an issue when it comes to, physical therapy. in this realm. When okay, how do we get out there and talk about our profession as a whole? So they talk about here, Hendricks, talk about in this case, share your photos of social media tags. So, we're all, you got Facebook, you got Face Live, you got all these different, search engines and web server accounts. That's what they were called back in the day. Now they just call them, Twitter and YouTube and stuff like that we're out there getting, and there's thousands of us out there doing it every day. And I hope to be one of the big ones someday. Ha ha ha. So that's really what I wanted to look at on this episode, is really start to dive into this part. Give you guys let me forget my words here. 3 things I really want to work on over the next, several months. One is this avenue, kind of going over some education piece. Where am I getting this information from? Or where is the profession as it's going? And then we have the second piece, which is my, going out and, the walks and stuff like that. And then the final piece, which is what I've been doing all along, is my pre-recorded, giving you guys some tidbits on ways to reduce your pain and improve your anxiety in the home. So hopefully this guy's kind of starting to give you some ideas on when it comes to the, in this case, this particular magazine, the American Physical Therapy Association. We have Medline, we have PubMed, there's a Scholastic website that Google has. So there's a lot of different ways that we get what's called peer-reviewed journals, which means that's very rigorous research data that's gone through the mill to really look at, is the article, what's it really coming to and saying? Is it truly saying that? So, which is not easy to, not by no stretch of imagination is easy to do, which I have done myself when I went to school for my clinical doctorate degree. So, like I say, that's the 3 things we'll be doing. We'll see how it works out for us. And hopefully you guys like this episode, and we'll keep going from there. But until next time, I always like to say, with Scully, look up and keep smiling. See you next time, folks.